and welcome. If you weren't here last week, if you don't know us, even though I think all of you guys do know us, but I'm Lisa. I'm mixed race, white English, and Black Zambian. I grew up in the UK in a majority white countryside town.
And my name is Isolt. I don't think I know everybody here. And I'm French and Irish. I'm white. And so that's the perspective that I'm going to be talking from today. So basically, to get started, for those of you who were here last week, you already know, but basically what we tried to do was kind of lay out the foundations to explain how racism is a structure and it's a system, and how we tried to explore how it was formed, one through religion and then through science, and then we tried to kind of explore how it's very much still relevant and very entrenched in our society to this day on a global level. Like, we had people from everywhere, so it was just such a rich conversation. It was really great. So today we're going to focus on whiteness in relation to the virus of COVID-19, but also obviously to quarantine and deconfinement also. And so at the beginning of the pandemic, we often heard this kind of discourse, which was like, you know, the virus doesn't discriminate. And like, I definitely heard that, especially when Boris Johnson got it, because, you know, it's like, oh, the Prime Minister of the UK has it. Even rich people get it, even government officials get it. But actually, the facts show that Black, Asian, and minority ethnic people are really disproportionately affected by the virus. So just to lay out, like, just the entire premise of this discussion relies on the fact that we consider race to be a major factor in how your life is shaped. You know, it's a very defining factor for everyone's experience of their life, depending on what their race is. So there are multiple things that are going on here, and, you know, the conversation about COVID could go into all types of directions. So we're going to try to unpack the various layers, and we're going to try to explore to see how racism is at play in this situation, well, in this crisis. So I think the first thing that we think of when we think about racism and coronavirus is probably the anti-East Asian and the anti-Chinese racism that was that came up especially at the beginning. And I'm not saying in any way that's not a reality anymore. It definitely is, but we're not going to really be focusing on those explicit forms of racism, like, you know, refusing to go to an Asian-owned business or something. We're going to be more looking at the structural aspects of race and COVID, and kind of see how they work together. So there's a lot this kind of rhetoric around, like, you know, we're all in this together, you know, we're all in the same boat, and we kind of argue that it's kind of colorblind to say that, and I would rather say we're all in the same storm, but we're not in the same boat. I didn't come up with that myself. I don't know who came up with it, but it wasn't me. But yeah, that original sentence is kind of colorblind because it silences and ignores the already entrenched power dynamics and inequalities that are already at play pre-coronavirus and that are just made worse by this crisis.
Yep, so as Isolt said, we're feeling like the force of this coronavirus, the force of quarantine differently. And just to cement this, I want to give you a few statistics. So these statistics are from a UK standpoint, from a UK perspective. And I just want to make a note that through a lot of this conversation, I'll be talking from a UK perspective. And so the first statistic is that ethnic minorities account for 1/3 of coronavirus patients in intensive care, despite only representing 14% of the UK population. The second statistic is that 2/3 of healthcare worker deaths from COVID-19 are ethnic minorities, and Black people are over 4 times more likely to die of the virus in England and Wales than white people. And obviously, like, similar statistics exist within like the US and within other European countries, except for France, or countries like France, where you're not allowed to legally measure data according to race.
So yeah, Lisa's just laid out a couple of stats on the UK and Europe, and I'm just kind of going to shift the conversation just to the US quickly. Well, just lay out a couple of stats because I'm going to be talking about the US later. So just to kind of lay out the groundwork, Black people specifically in the United States only represent 13% of the population. It's really proportionally not that much, especially when you take into account the fact that they make up 40% of the COVID-19 deaths. So there's only 13% of the population, and they make up almost half of the COVID-related deaths in the United States. By comparison, Asian American and Latinx American respectively make up 18% of the deaths by COVID, and white Americans only make up 16%. So these are really high, stark differences. And so I want to use the example of one city to kind of illustrate this, which is the city of Chicago. So there's 70% of the deaths in Chicago are African American people, but they only represent 30% of the city. So that here, I was only talking about the African American experience here, but we'll include other groups later on in the conversation.
Yep, so what these statistics show is that there is a problem with our healthcare system and a problem with our general society. And obviously, as we're speaking about and as we spoke about in the last seminar, we know that this problem is the omnipresent force of racism. And so I'm going to start off the conversation by talking about ethnic minorities as key and essential workers and how this creates a disparity in coronavirus infections and death numbers. So if you've been to a hospital recently, I'm sure you have noticed the ethnic diversity amongst the staff. And so in the UK, 20% of all nurses are BAME, Black, Asian, minority ethnic, and this is 44% of all doctors. So that means almost half of the doctors in the UK are Black, Asian, minority ethnic. And so this shows that ethnic minorities are overrepresented. You know, as I said earlier, ethnic minorities make up 14% of the general population, but obviously these figures show the overrepresentation. And so what does this mean for COVID? This means that ethnic minorities are disproportionately at the front line of the COVID outbreak. And we're not just talking about it within hospitals, we're also talking about other essential worker roles such as care workers, where we can see that in London, for example, 67% of the social care workforce is ethnic minority. We can also talk about bus drivers, taxi drivers, delivery drivers, supermarket workers. So as I said, this means that there is a higher, exposure to the virus within these roles. And so this is where a disparity can manifest. But I also think that it's important to talk about the treatment of these essential workers. And so obviously these ethnic minorities who are making up the workforce are instrumental in the fight against corona. And, every Thursday in the UK, for example, well, today we just, clapped for our NHS workers, our carers, all of our essential workers. However, at the same time, it's these very groups that are made up of ethnic minorities that are being discriminated against and marginalized by society. And so we can talk here about, I don't know, I'm sure you guys have heard about the recent news where a Transport for London worker, a Black woman named Belly Mujinga, who died after somebody spat at her whilst working, for Transport for London, for TfL. We can talk about in the US, the murder of Breonna Taylor, who was a emergency medical worker and who was shot by police 8 times, in her own house. And we can also talk about, within the workplace, for example, ethnic minorities are twice as likely to face disciplinary action. Ethnic minority doctors are twice as likely to face disciplinary action than white doctors, even though they are half as likely to complain. Therefore, we can see that ethnic minorities are continuously working hard, continuously putting themselves at the front line with very little complaint, but they're being taken for granted and they're being discriminated against. And so I want to reference a video that I watched recently on Facebook. Somebody shared it on my Facebook feed. And it was by a Black British comedian named Gina Yashir. And basically she was talking about how a few weeks ago, as she was looking at the mainstream British press or the mainstream British newspapers, she saw that, whilst we were praising, as a nation, we were praising the NHS, she couldn't see any ethnic minorities on the front pages of these newspapers. And she was asking, where are the people that we know? We know that the healthcare system, we know that the NHS is diverse, but why are they being left out? And so she started the hashtag Stop the Whitewash for this, but in relation to the coronavirus whitewashing. And this goes back to what we were talking about last week, how whiteness is the center, whiteness is the spotlight. And Black and brown people, even when they're very much involved within the story, they're not even put out there on the front pages. And so perhaps if it was a story about gangs in the UK, or if it was a story about refugees, we would see Black and brown faces like plastered all over it. But when it comes to this, when it comes to like praising the nation, they're not there. So this kind of represents a cognitive dissonance where we clap and we praise our NHS workers, our essential workers, but we ignore their the oppression that they face. And this is nothing new. I want to take you back on a journey to the formation of the NHS. And so the NHS was formed after the Second World War with the creation of the social welfare state. And it was the first universal healthcare system established in the world, that we know about, from a Western perspective. But so the birth of the NHS coincided with the 1948 British Nationality Act. And this act meant that all citizens of the Commonwealth, so Britain's subjects from the colonies, were allowed to get British citizenship in order to work in the UK. And this started like a mass migration from places like the Caribbean, from places like South Asia, where workers were coming, to help and build this, to build the state. And so, a lot of these migrants who came worked as nurses within the healthcare system, within, the recently birthed NHS. And so, adding on to this, in the early 1960s, none other than Enoch Powell, who was health minister at the time, made an appeal for doctors from Pakistan and from India to come again and, in the same kind of, with the same intention to help build up the state, to help build up the healthcare system. And so we can see now that the formation of the NHS was really defined by the migrants. But ironically, the same guy, Enoch Powell, who I said was health minister, who invited, these people, was the same guy who, slashed these people, who condemned this mass influx of migrants. In his notable, like infamous, like xenophobic and like horrifically racist speech entitled "Rivers of Blood," he talks about the threat of the immigrant. And if you haven't read, or if you haven't read or heard Rivers of Blood, I definitely recommend that you check it out, because even today it's still used amongst like far right groups to justify, their rhetoric against ethnic minorities and against immigrants. And so I just want to give you one quote from this speech, and he says, "It is like watching a nation busily engaged in heaping up its own funeral pyre." And so again, as I was saying, this reflects like the cognitive dissonance of the nation, where they're, praising these institutions, but they're not acknowledging where they came from and how they came off the back of oppressed Black people, oppressed ethnic minorities. We only have to look at slavery to see why like the UK is a big power in the world, why today it's wealthy in the world. We only have to look at migrants, as I said, when we're acknowledging the formation of the NHS and bringing it back to Corona. It's the ethnic minorities who are disproportionately at the front line, but we don't acknowledge this. And if you want to say right in this time that you're proudly British, you're proud of the way that the country is dealing with the epidemic, with the pandemic, then you can't ignore the people that are putting in the work, who are instrumental but are being discriminated against.
Now I'm going to move on to the social determinants of health. so we know that the people, as Lisa just said, we know that the people who are dying from COVID are often, well, actually, Lisa did just say that, but the people who are dying from COVID are often people who have pre-existing health conditions. So, at the beginning, we often thought of elderly people whose immune system might not be as strong as it would have been when they were younger. But who else is dying? So the people who the people who are dying from COVID are people who already experience systemic inequality, poverty, and discrimination. And COVID is shining a light on those three things, and it is also worsening them, but they're coming through the cracks, very clearly at the moment. So people of color, and more specifically Black people, are disproportionately low income essential workers, or they're overrepresented in those types of jobs. So I'm thinking of, cashiers, delivery staff, warehouse staff, food chains, fast food chains, cleaning staff, et cetera, et cetera. And all of these jobs have very high viral exposure rates to COVID-19, and often they don't have very much worker protection. So I'm thinking, of health insurance, medical leave, implementation of corona-related measures. So, sometimes at the moment, especially with countries who are starting to relax lockdown, people are forced to go back to work in unsafe conditions. So the people who are forced to go back to work in those unsafe conditions are more likely than not poorer people. And so poverty is a huge factor in the midst of this crisis. And what goes hand in hand with poverty is, unfortunately, the fact that people of color are overrepresented in, poverty rates. So often people of color disproportionately live in poorer areas where the housing is sometimes of much poorer quality. I'm thinking notably of Grenfell, where there was a large portion of immigrant population who was victim of Grenfell. In the UK, for example, Black, Asian, minority ethnic groups are more likely to live in overcrowded accommodation. For example, 30% of British Bangladeshi people in the UK live in overcrowded accommodation versus 2% of white British population. And another issue with overcrowding is also the fact that a lot of people have multi-generational households. And of course, this is a risk for older people. So for example, if I lived with my grandma and, I was working or something, there's a risk of your family getting infected or whatever. So poverty and racism pre-corona already highly contributed to, health disparities between not only classes, but also races. And we know, like, these are kind of facts, that Black people, for example, in the UK, but also in the United States, I don't know about France because we can't do that, but we can't calculate that. But Black people in those places, we know that they have shorter life expectancies and that they're more at risk of some health conditions, namely kidney and heart disease, hypertension, diabetes, etc. And we see that people of color who are often subject to pre-existing health conditions makes them at higher risk of contracting COVID. For example, 2/3 of British Bangladeshi men over the age of 60 have long-term health conditions. In addition to that, what's going on right now with the NHS and what's been going on for a very long time in the United States is the privatization and the defunding of public health care. And this really has very detrimental effects on the most vulnerable people, who are often people of color, or minority ethnic groups, or whatever you want to call them, because they have a lessened access to healthcare. And I think another aspect which is quite important to mention is environmental racism. And so, we know that in certain areas where you'll find like a power plant or a factory, we know that the people who live in those areas are disproportionately people of color, and living in an area like that highly influences their health. So for example, a place where there's fumes being released into the atmosphere, you see higher rates of asthma in the children. So yeah, this is a reality. And if you combine all of these pre-existing inequalities, so lack of health services, inadequate transit access, inadequate, working conditions, living in a crowded apartment, poor relations with the police, environmental racism, and poor relations with the police, especially now with the fines being put in place for people not respecting self-isolation measures, of course there is discrimination regarding the virus and how we're impacted by it. So I'd like to end this part with the words of David Williams, who's a Harvard professor in medicine and African American studies. And he says, quote, "Health builds from where we live, learn, work, and play, and only secondarily from the doctor's office."
So Esau left us with a nice quote there, and so I want to now talk about this second stage of health discrimination, which is inside the doctor's office. So in the last seminar, we talked about the construction of race and how, you know, these racist attitudes, like the racism, like as an institution, was constructed in order to justify slavery, to justify the subjugation of Black bodies. And so, you know, we talked about how these ideas, attitudes, this structure has been, you know, transferred into our society today. And so one of these attitudes that I want to talk about now is the myth that Black people feel less pain. And so obviously, we can see that this was used to justify like getting the whip out, to justify burning, to justify cutting off the genitals of slaves. And so, you know, I want to talk about here, this like moves me nicely on to talking about the father of gynecology. And I want to talk about him because it's a good example of, you know, notable people within the medical profession, you know, believing and perpetuating and producing this this myth. And so the father of gynecology is a man named James Marion Sims, and he developed the practice in the early 1800s by operating surgically on enslaved Black women, but without anesthesia. And I just want to give you a quote by this very man, and he says that negresses will bear cutting with nearly, if not quite, as much impunity as dogs and rabbits. So as I said, this, you know, it wasn't just an idea that was just like randomly floating around. No, this was an idea that was, as I said, produced, perpetuated by those notable physicians and surgeons. And this idea still pervades society today. And so I want to talk about a study which was published in the US in 2016. And also I want to make a note that the studies that we talk about here, we'll put them like on a document so that you guys can check them out after this seminar. But yeah, so a study that was published in 2016 in the US found that 40% of first and second year medical students believed that Black people's skin is thicker than white people's. And so another study from the same year found that Black people are half as likely to be prescribed opioid medication in emergency departments compared to white people. And this, you know, pain relief is like specifically severe because we know that untreated pain is linked to depression, sleep disruption, skin ulcers, weight loss, and it can worsen other existing medical and psychiatric problems, you know, also leading to chronic stress, which means that, you know, that in itself, you know, not having correct access to pain relief can already exacerbate those pre-existing like health disparities, you know, as Esau was talking about previously. But overall, what these statistics show is that Black people are not taken as seriously in a medical context as white people. Their issues, you know, aren't dealt with properly. And so how does this translate in the current dealing of COVID? So, you know, Black people may feel more reluctant to go to the hospital due to maybe past experiences of them, you know, of the doctors not considering them as worthy, you know, subconsciously mostly, but probably sometimes, you know, actually consciously. So yeah, it might take them a longer time to get to the hospital. And as I said, when they do get to the hospital, they might be treated, you know, with not as much care. They might not be given the right medical treatment. And this means that the virus can worsen before they get the proper medical treatment. Esau, you're muted, babe.
So yeah, moving on from that, I'm going to be talking about the North American indigenous situation, focusing on the United States. And so all the information that I'm going to share now either comes from news outlets, which we will share with you, or with indigenous media sources directly, which we will also share with you. So to move on from what you were saying just before, Lisa, this discrimination, racism, and abuse that you're talking about within the Black experience is very real, and it's also very real in other groups, the indigenous groups, especially with women, within medical facilities. And so, I'm talking about the issue of not being taken seriously, being operated on without your consent. There are multiple UN reports on this. And so just to give a bit of an overview. Hello, can you hear me? No. Hello.
Yeah, we can hear you, but your visuals are like coming in and out. But we can hear you.
Okay. I think
but it keeps like freaking.
It keeps what? Freaking?
Like the visuals keep freezing. But I mean, you
Is it better?
consistently. I mean, yeah, for the moment.
Okay. All right, so just to give you a bit of an overview of what's going on in the United States at the moment. So the New Jersey population is almost 19.5 million people. New York population is almost 9 million people, and the Navajo Nation is only 175,000 people. So to explain for those who might not be familiar with it, the Navajo Nation is basically, Navajo is an Indian tribe who, and the Navajo Nation is their land. So with treaties that were signed 200 years ago, they own land, and so the Navajo Nation stretches, so it's a nation that's unrecognized in a similar way to Palestine. Basically, it's a nation within a nation, and the Navajo Nation stretches across New Mexico, Utah, and northern Arizona, just to locate it. So so basically, yeah, New Jersey has 19.5 million people, New York 9 million people, and the Navajo Nation 175,000 people, so it's much less. Yet the Navajo Nation has the highest infection rate had the highest infection rate just after New York and New Jersey for the first, for March and April of lockdown. And if the Navajo Nation were considered to be a state, they would have been third, just behind New Jersey and New York. And now, since this week, the Navajo Nation has become the highest infection rate per capita in the entire United States. So that is like insane, considering how small the population is. It's really, really worrying. And so just to give you a bit of a picture, just in case that wasn't enough, in Arizona, 16% of the deaths are Native people, but they only make up 6% of Arizona state's population. So, this is just mad. And they're also being left out of the death count and classified as other. So if you remember the stat that I gave earlier, it only concerns Black people, African Americans, Asian Americans, Latinx Americans, and Caucasian Americans, and it basically, they would have been classified as other in those types of statistics. I'd also like to give you a quick comparison between the state of West Virginia and the Navajo Nation, because they're similar sizes. So West Virginia is 24,000 square miles, and the Navajo Nation is about 27,000 square miles. And in West Virginia, there are 163 grocery stores, and in the Navajo Nation, which is slightly bigger than West Virginia, there are only 13 grocery stores. In West Virginia, there are 63 hospitals, and in the entire Navajo Nation, there are only 6 hospitals. So very clearly, there's a very serious lack of access to healthcare. There's also water shortages, multi-generational housing. Grocery stores and hospitals are very limited in amount, very limited in resources, space, and funding, and they're hours away. So there's, health insecurity and food insecurity. And due to the lack of medical facilities, locals have put up their own checkpoints in order to kind of monitor who's coming in and out of the nation, and in order to try to control the infection rate. So South Dakota Republican Governor Kristi Noem has required the Navajo Nation to remove their checkpoints because she estimates that they're unlawful, and she's threatened to take the matter to court. and to federal court. And I think it's worth noting that South Dakota is one of the only states that has issued no stay-at-home bills, no stay-at-home orders, which further puts Indigenous people at risk. I think it's also worth mentioning, though I'm not sure how important this is in a United States context, but I think elsewhere it might be, in other places I think it's an important element, which is that often relevant information about infectious diseases and preventative measures to deal with them are not available in Indigenous languages. So I think in the United States and Canada, most people speak English, but I'm thinking of Africa, of Latin America, of Asia. So this is a real issue. So there are over 500 federally recognized tribes in the USA alone, and all shared together, they're getting, like all of them, the 500 are getting, they're getting $8 billion in relief to share, to deal with the coronavirus, when that same United States government is giving big corporations $500 billion in bailouts. That is mad, like just mad. So actually Trump is, he's supposed to go to the Southwest pretty soon, I think maybe next week or something. So he declared that the Navajo Nation, looking at the rates, would receive $600 million because, according to Trump, and I quote, "You have been through a lot." So I just think, you know, I think it's very interesting because Indigenous people have been fighting plagues, epidemics, and pandemics since 1492, when Christopher Columbus discovered the Americas. So I think what's going on right now is highly symbolic, because this is not the first time that they're fighting this type of virus. And also, there are many scientists who believe that there's a causal relationship between human activities and spreads of epidemics or pandemics like this one. When scientists say that, they're thinking of coronavirus or other types of COVIDs, but also Ebola is a good example. And the reason why they say that there's a causal relationship is because when we practice land extraction, when we practice deforestation, we have an impact on the local ecosystem. So for example, species lose their natural habitats, like for example, bats lose their hosts. And that means that with urbanization, with deforestation, there's a closer proximity between humans and animals. And so we contract viruses that they would only usually spread within their surrounding ecosystem. Normally we wouldn't get them, but because of our practices and our increased proximity, we're getting these illnesses that we've never had before. So I'd also like to add that 80% of the world's biodiversity is located in indigenous tribal territories. And I'm mentioning that because the same people who are defenders of the land and have been for, you know, a few generations are also the same people who are disproportionately affected by the virus and simultaneously affected by climate change. And they're still fighting against climate change while they're being, you know, it's horrible, but while they're being decimated, you know? And I think it's just ironic because this virus is to some extent a symptom of climate change. So I think this is really important because it concerns not only a systemic discriminatory lack of access to healthcare, but also a historic systemic pattern of environmental racism towards, as Lisa said, Black and Brown folk, but also here specifically Indigenous people. So I use the Navajo Nation as a case study, but you know, there are over 400, sorry, wait, there's just, sorry, one sec. Yeah, there's over 500 federally recognized tribes. There are actually way more. You know, there's also all of Canada, all of Latin America, all of Africa, all of Asia. So we're going to provide you with some links if you can, if you're interested, so that you can, you know, like GoFundMe pages and things like that if you want to donate to either North American tribes or Brazilian tribes or the Ecuadorian Quachi tribe who are suffering from floods at the moment. And so I'm just going to leave it at that for the moment. But if you're from another country or if you know anything else, and we would love to open the conversation to a more global, you know, level if later.
Yeah, so now I'm going to move on. I'm going to move the conversation to policing. So we all know, or we all should know, that the police is a racist institution, and we don't even have to look far to prove this. We only need to look at, the recent news of, the cold-blooded murder of Ahmaud Arbery, whilst he was jogging back in February, or, as I mentioned earlier, the killing of Breonna Taylor, who was actually a healthcare worker who was killed by police in her apartment, in her safe space. And so during this quarantine, there's been a lot of images and videos and just discussion like floating around social media recently, showing police officers, in the US, dealing with quarantine differently, in white neighborhoods as opposed to in black neighborhoods. And in white neighborhoods, we can see police like handing out masks in like overcrowded parks and just generally being like chill. And then, when we look at black neighborhoods and we look at the police response there, we can see, police being brutal, for people who are just taking, their daily exercise. We can see like videos of police, just, brutally like kind of interjecting or in some cases like beating them for such. And so this reminds me of a film that I watched recently, and I'm sure some of you guys have seen it, but it's a film called The Hate U Give, which was directed by George Tillman Jr., and it's on Netflix. I really recommend watching it. It's about like police brutality like in the US today. And so there's a scene within this film where the protagonist, Star, is talking to her uncle. They're both African American. And basically, they're talking about her uncle, who is like a police officer, is talking to Star about like how like the situation of when a police officer may shoot at somebody during maybe like a traffic stop or something. And so he was like explaining, he was like describing that if it's dark and the police officer is by himself, and perhaps the person leans into his car, the police officer is going to automatically think, he's reaching for a weapon. And so in that case, he was just like, you don't even think, you just shoot, in protection and self-defense. And then the protagonist, Star, asks her uncle, what if it was, a white man in a white neighborhood, wearing a suit and driving a Mercedes, would you still shoot? And he goes, no, I would probably ask him to put his hands up. And so I feel like this is just like a really good illustration of the difference in police response, just on a general level, but also through this virus, between different racial, like different neighborhoods. And, a lot of the time when we talk about like excessive policing, we talk about the US. However, even in the UK, we know that Black people are 10 times more likely to be stopped and searched than white people. And so, there's already this, as I said, there's already this excessive policing. And, the virus can only exacerbate this, because right now we see police having more powers, and, they can also hide behind the excuse, hide behind the guise of, I'm doing it within the public interest. And so we have questions now of police abusing their power. Like, I know personally, I've seen articles from the UK and I've seen articles from the US, where people are discussing the excessive force or by the police. And this is, problematic as well, because police are like vectors of the disease. They can pass on the disease easily, and sometimes they might not even be wearing protective gear, and they might not be actually be obeying like social distancing, which is ironic because they're there in order to control and in order to like protect this quarantine like situation. However, they are easily like spreading the disease. And whilst we're talking about police officers as vectors of diseases, of this disease, of this virus, we can also talk about prisons as hotbeds of the virus. And we obviously know that prisons are disproportionately ethnic minority, like within the US and within the UK. So for example, in the UK, 14% of the general population is ethnic minority, as I've said, but they make up 25% of the prison population. Therefore, Black people and ethnic minorities are going to be disproportionately affected in prisons. And so we need to ask, where is the duty of care?
So even in France, where we mentioned this last time, but just in case you don't know, in France we can't do any statistics like very as opposed to the UK or the US, where you can clearly do statistics based on race or origin or ethnicity. That is an absolute no-go zone in France. But even there, we still know that the trouble or the tension or the lack of cooperation with social isolation and social distancing in France has been in areas where people of color are happen to be overrepresented. I'm thinking, for example, of northern Parisian suburbs. But I'd like to ask the question, who can really afford to, as Lisa just said, who can really afford to stay inside? Who can really afford to socially isolate? Who's more likely to own a second home? Who's more likely to be able to have an option to leave the city? And of course, all of these are class issues, but because they're class issues, they are also racial issues. So I'd also like to ask, who is outside and why are they outside? And, who is perceived as a threat if they do go outside? And also, who is perceived as a threat if they cover a part of their face? So I'm talking here from a very French perspective, but in 2010, the French government passed a bill which prohibits one from covering their face in public spaces. So that bill was very clearly aimed at Muslim women who wear the niqab. And now with COVID-19, obviously people are going to have to wear masks in public transport, in maybe in some institutions, public spaces. But again, I'd like to ask the question, but because the racism that pushed that bill to be passed is still very much a reality. At the end of the day, 10 years down the line, things haven't really changed that much. That racism, which motivated and fueled that bill, is still very real. So again, who is going to be perceived as a threat when they cover part of their face? So yeah, I just think it's kind of food for thought. But now I'd like to move on to the explanation of basically, so I'm going to explain this theory. Well, it's not really a theory, but basically imagine, so I'm going to define something called a panopticon. So it's just an architectural design for a prison. And the reason why I'm bringing it up is because the French sociologist Foucault studied that specific architectural design in order to argue that it was a really good metaphor for social control and for surveillance. So imagine a circular prison that's like this, and in the center of the circle you have a tower, and at the top of the tower you have a room where the guards, you have the circular prison like this, so you have all the individual cells lined up around, and in the center you have a tower with a room at the top where the guards stay in, and like that, from that room they can see the entirety of the 360 perimeter. So what happens in that scenario is that the prisoner can't see where the guard is facing when. So the prisoner has to presume that he's always being observed, that he or she is always being observed. So, but they don't know when. So on the off chance that they might be being watched, they need to self-discipline. And what Foucault argues is that self-discipline and that social control becomes normal, and becomes normal in the individual psyche and in the collective psyche. So I think I'm bringing this up because in the French context, post 2015, post after the terrorist attacks that happened around 4 or 5 years ago, the government put in place as a response a state of emergency. And what happened was that they're supposed to have decreased that state of emergency, but actually the policies that were put in place, the measures that were put in place, are still very real. So for those of you who have lived in France, who have traveled through France, I'm sure you've noticed really high police presence in train stations, metro stations, even in the street. We have army presence in train stations, with big guns, not just like in an airport or something, like in a train station, in a normal average train station. Really high police presence in protests. And I think this really normalizes this controlling presence. And I think it's worth thinking about, because this is a state of emergency, I think it's worth thinking about, and especially here in France, we've had very high police presence in the street in specific areas. I think it's worth thinking about who, you know, the difference in treatment in white versus non-white treatment in regard to policing and social distancing, and how is this going to pan out in the aftermath in the next few months of COVID-19. So going on from the difference in treatment, I'd like to just mention briefly the protests that we've seen. I'm actually going to be pretty global about this. I'm not going to speak about one country. Well, I'm going to give examples, but it's not specific to anywhere. So here in Paris, on Monday, there was a protest in the northern suburb, which is, again, disproportionately people of color are overrepresented in that area. And they organized a protest against police brutality, where they formed like a human chain in order to respect social distancing. We've also seen protests against police brutality in Brooklyn. Indigenous people across North America have been doing virtual protests, mostly is what I've seen. And, you know, they're very active against the construction of pipelines like KXL, or they're being very vocal about defunding from asking big banks like JP Morgan Chase to defund from fossil fuel industries. So they're very active. So I think this is very interesting, and, you know, they're fighting for quite important things. And then you look at what white people have been protesting recently in the UK and in the US, and I'm thinking namely of in the UK, there's a protest going on this weekend, which is organized by Britain First's former leader, who basically these protests are against the oppression and of lockdown and the lack of freedom within lockdown. And like they're arguing that you know, they're protesting against social distancing, a supposed oppression that they're feeling. But as we've tried to explain, it's not white people that are feeling the brunt of what's going on right now. There are other groups that we've tried to explain this, that are clearly are impacted more severely by this. So we're clearly not fighting the same fights.
Yeah, and so now that we have spoken on the different issues, I just want to bring it back to what Iseult said at the beginning. And the quote that she gave was, "We are all in the same storm, but in different boats." So, you know, we can talk about, you know, as we mentioned at the beginning, you know, shouting out things like we're all in this together is ignoring the disproportionate effects that the virus is having on Black and brown people as opposed to white people, you know, as well as, you know, poor people as opposed to rich people. So we need to talk about, you know, who has access to a safe and decent space to quarantine, who has the means to go for a leisurely jog without being harassed by the police, who can go to the doctors without fear of not being taken seriously, and who has the choice to stay at home instead of going to their essential work where they could well be exposed to the virus. And also, I just want to mention, like, before we did this seminar, I was watching the news, BBC News, and they just were talking about a study which said that Black people in the UK are 4 times less likely to have access to a garden during this quarantine. So, you know, here we can talk about this disparity of, you know, space, like who has access to this space, to a decent space, you know, to comfortably quarantine.
Yeah, 100%. And as I was kind of talking earlier, there's an echo.
I mean, it's fine from.
So because white people are most likely to be the ones who possess a second home, as Lisa just said, because they're more likely to have more secure jobs, they're more likely to be able to work from home, because they're more likely to not be essential workers, they're more likely to have an access to have internet access. They can afford to protest about needing haircuts, and the response might be that they'll be given masks by the police. But what I'm trying to say, like more seriously, is that really we white people don't face the structural and systemic health disparities that people of color and Black and Asian and minority ethnic groups face. And when we do go out, when we do have to go out, we're not perceived in the same way. So I think, you know, since the beginning of confinement, there has been a conversation about racism in relation to COVID-19. I mean, at least when me and Lisa were doing our research, we found loads and loads of articles. But there is also a trend in people kind of saying, oh, you know, you shouldn't see race everywhere. Like, not everything is about racism. And I think two things about that. I think, first of all, that's really minimizing a very serious issue. And also, I think that it's gaslighting, you know, it's kind of, it's really choosing to push aside a very important part of the crisis. Because again, it's about whose lives matter. So something that's really important here is how white supremacy is being maintained at this time. And this is not to say that white people haven't died from COVID or that they're not impacted in any way. Of course, you know, we're all in the same storm again, but the reality is that, again, other groups are feeling the brunt of it, and we hope that this discussion has kind of helped maybe clarify why. So, you know, the aftermath of COVID, well, COVID has reinforced, and, you know, in the aftermath, it will reinforce already staggering inequalities between classes, racial groups, etc. And so I think us white people really actively, now more than ever, need to engage, well, not more than ever, but we need to actually do it. We need to engage in these conversations, and we need to really reflect on our own positionality within them. And so I'd like to end on something which maybe is a little bit controversial, but I will argue that the real crisis is capitalism, and by extension is white supremacy. So thank you for listening to us.
Yeah, now we want to open up the discussion to hear your thoughts, opinions, questions, everything. Just want to, yeah,
experience, how you're dealing with quarantine.
Yeah.
Well, I really wanted to attend this seminar seminar today because of research that I'm doing for the Columbia Daily Tribune, which is the newspaper that I work for. I'm working on a project specifically about the Black community here and how they're disproportionately affected by COVID. And I found some really interesting stuff. So I don't really have anything other than the data that I've shared already. But I live in the first ward. I live in the middle of Missouri, which is a state in the Midwest South. Where racial tensions are like very high, and just there's a lot of history here. And I live in a predominantly Black neighborhood in the first ward because it's a poor neighborhood. And I started noticing it as COVID was hitting our community. More and more people in my community were outside and congregating at the parks, and I didn't understand really why. And I was like, it made me take a look at the district that I live in, and I started doing some research. And basically, the district that I live in is predominantly African American because in the 70s, with the federal program Urban Renewal, the federal government bought back a lot of the land that Black businesses and communities sat upon, and in doing so put those families into public housing and basically undercut an entire economy, bought back that land and just bulldozed businesses. And so I am living in the place that African Americans were pushed back 30 years. Last summer, I did a story on the spike in violence that I saw in my neighborhood. Like 15 minors under the age of 18 were shot. I would hear gunshots at night, and it was really scary and really odd. And I started covering that. And what I realized was there was familial and social connections between the people who had been pushed in the 70s out to these areas with the people who were getting killed. So the people whose families were pushed out of Sharp End, which was the name of the Black district in the 60s, their grandsons were getting killed and getting caught up in gun violence and prostitution and things like that. Basically, what now I'm looking at is that a similar disproportionate relationship is happening with COVID patients. And I'm really curious to see, now we only have a few Black businesses in Colombia. I'm really nervous for them, and I'm anxious to see how they're going to survive this, because I did my research this morning, and there in my town, it's 8% Black, 8% of a Black population, African American population, and 15% of the people in my town who were tested positive, 13% of the positive tests are African American people, and 100% of the people who tested positive in my county who have COVID and are African American live in my area, on my street and on my blocks. Wow. And so I just have all this, I don't know, I've been going back, and there's so many pieces to this. And so I'm working on a project now, trying to talk to Black business owners and things like that, because the Columbia, even after Sharp End was kind of destroyed, our city has not done hardly anything to help rebuild the African American population whatsoever, except for arrest Black people who've killed other Black people. So it's just, that's what I found this morning, and I'm really interested to look into kind of some of the data that you guys sent, because I don't know, I'm scared. I'm scared, and so are other people, but that's just the research that I've been doing. So I appreciate you guys talking today, because I think that this is something that's gonna kind of blow up. And I have wanted to write this because, as well as I'm in the middle of Missouri, and there's a lot of ignorance, and there's a lot of people saying that race doesn't have to do with this virus. And I am in a place where there are a lot of people protesting the stay-at-home orders and being like, that shit doesn't affect me. Like, I'm going to be safe. I'm going to be fine. Mostly white businesses wanting to just make money again, and white citizens just wanting to get back to their work. So thank you. And that's what I've been working on lately.
Thank you. That's so interesting.
Yeah, thank you for sharing. Like, really, really interesting.
I'll keep you guys updated.
Yeah, definitely.
Like, keep us posted on the development.
Definitely.
That's mad.
It's mad. It's crazy.
Yeah.
And I will say, I do see more police people in my neighborhood now, and that scares me too, because when you have congregating African American folks, like the ones I literally see out my window right now at this park, the more there are police and the more there is violence. So
I have a question as well. It's more of a comment on what you guys said before, on the environment and the fact that the environment's kind of being left out of this discussion. I feel like I've noticed just in general with like the news that we're receiving, that we're at the start of the pandemic, we got very clear, or we've been getting at least somewhat regular updates on the economic policies that are going to be put in place in order to reduce like the impact of the pandemic on our economy, right? But I have not seen personally any environmental policies that will be put in place to maintain the positive effects that the pandemic, or rather us staying at home, has had on our environment. What I have been seeing on the news rather is the conversation about economic policies on one side, and then articles of how well the environment is doing right now, but no connection between the two. I just want to know what you guys, everybody thought about that as well.
Yeah, I think you're totally right. And I think what's really shocking is, I mentioned indigenous people, so I'm going to mention them again. Like, pipelines are still being built. Like, Keystone Pipeline is in Sioux territory, is still being built right now. In March, it was still being built. And I just think that's just so crazy, because like, symbolically it's so heavy, that this is still going on. And also, I'm sure you guys have seen, you know, we see the nature, like ducks in Paris or in London, and it's like crocodiles in Italy, or dolphins in Italy, like nature is taking over again. And there's kind of this idea that the human is the virus and all of this. And I really think that that's really dangerous, because I'm kind of like, humans aren't the virus, capitalism is the virus. And exactly as, you know, you're saying, we see, you know, the urgent, like, what they're trying to put in place as fast as possible is how are we going to cope economically speaking, which, you know, I'm being realistic, is important because people need to eat, and right now we function with a monetary system, so we do need to respond. But yeah, I don't know, I just feel like,
this is the thing. I think like my question is more so just kind of like, why is it our economy first and not our environment second? You know,
it's always been that way.
I was trying to find a statistic as you were talking, because I did actually see like a news story from the UK, where people put it to the government to kind of tackle green issues following like the coronavirus. But I can't remember like the specifics. So actually, this isn't very much help at the moment, because I can't remember like the specific kind of terms of this
Was this
thing.
was this the pause group of people?
I can't remember. Like I just saw it. Like I didn't even read into it that much, to be honest. But I saw a headline that somebody had posted that about like the government and green issues after COVID. So yeah, I'm trying to find it now. But
Well, like Boris is trying to push his whole bicycle thing to get everyone to cycle. But also, just at the start of the whole thing, before we all went into lockdown, there was a group called, I think, Pause the System or something like that. I think there might have been like an XR shoot-off. They were basically saying, like, you know, the only reason that this is now going to be a catastrophe is because of the whole economic system that we have, right? Like, so this actually, you know, arguably some people have weathered this fairly well. And I'd say, for example, again, South Africa has recently, they announced their statistics, so that around about the same timeline in the UK when we had 19,000 deaths, and they've only had about 200. So they went into lockdown really early. Now, I'd be quite interested to sort of see like how these death statistics compare for basically Black people in like Africa compared to living in sort of, you know, the UK and the US, and same for, you know, people in Asia, and sort of like, is there any actual correlation, which obviously there won't be, you know, it's going to be due to sort of economic situations and stuff. And I think it's a good opportunity as well. You know, everyone talks about the new normal kind of coming out of the whole lockdown. And it is probably one of the best opportunities that we kind of have to sort of build a new economic system where kind of, especially one based on equality, right? Like now there's this like glaring statistic of saying like, look, you know, in the UK, for example, if so many, you know, BAME populations suffered so much from COVID, like we clearly have to do something. Also because, you know, a lot of it is down to sort of the economic situation like that they're in. So there's like a, you know, something you can do to fix it basically.
Do you have anything to add, Lisa?
do you have anything to add, Esau?
No, I don't know about the South African situation per se.
I mean, from what I know about just like talking to my parents who are back home in Kenya, they went into quarantine around the same time that we did as well. But like Tristan just said, the virus did not hit Africa that badly to start with. And so they're going to have talks about, so they're going to get their official announcement from our president this week on when they're going to lift the restrictions. And we anticipate that that'll be like anytime soon.
How do you guys think about these numbers that we're getting with how many people have COVID and things? Because in the US, testing is something that's very like a hot topic right now. Like it's also a way to make it seem as though the problem is not so big, like in the communities that don't have as much money. And this is rural. This is also just like poor white people in America. I think there might, I don't know if this is a thing for whatever, but there's not enough resources for there to be testing, but I think a lot more people are getting sick. And so I'm curious about that as well, because as you were kind of, we touched on earlier, maybe African Americans would be more wary to go get tested and things like this. But there are reports of people getting sick. So how do you feel about like the numbers that we can rely on in certain communities?
Yeah, I mean, I don't think the numbers are reliable. Like even on a general level, like, you know, the amount of people generally in the population that have been tested is probably like more than the official. I mean, like the official number is probably like, what am I saying? Sorry, I've lost my train of thought. But basically, the amount of people that have been tested and who have, you know, been shown to be infected with the virus, you know, it's probably just like a small proportion, yeah, as you said, of the amount of people that actually like harbor it. And you're right, like, you know, who is being tested, because still in the UK, it's not everybody that's being tested. So it is, you know, certain kind of, you know, groups of people and stuff like that. And yeah, as you said, it is definitely something to consider, you know, considering maybe Black people don't have as much trust within the institution and stuff. So yeah, I do suspect that maybe it's even more than what we know right now.
I've heard suggestions that basically whatever the official number is, depending on what the testing capabilities are, it's usually about 3 to 5 times the amount of actual population that's been infected. And then there's also the whole point of, you know, there might have been earlier strains that went round. Like there was a whole thing in London might have actually had quite an early strain in like December as well. So, you know, there's a whole question on that as well. So I'm sure there's a lot more that we'll find out.
And there's also a margin of error with the tests. Like I've seen that they've got quite, oh, there's Kamala's back.
Ah, yeah.
Yeah, there's a margin of error with the tests, right? So like there's false positives and false negatives, which can in turn be quite dangerous or unnecessarily stress someone out. So yeah.
Has anybody got any?
You're back. Oh, I don't know if you can hear this.
I'm not sure.
So yeah. Does anyone have anything else to say? Teacher in front of silent students.
When are you guys going to have another seminar? Do you know? Do you have a plan?
We're planning to do them every 2 weeks. So we have like a few ideas for the next one. We're thinking about potentially doing the next few ones on like the green issue, like environmental like activism and whiteness, and like feminism and whiteness. And we have like other ideas, but we do plan to do them like every 2 weeks at the moment. Welcome, Kamal.
No.
Yeah, does anyone want to give us like different perspectives from different countries, different yeah.
Anyone?
I mean, like, what about the whiteness of mental health in COVID? Like
COVID. Oh yeah, actually that was something definitely. Okay, so I'm going to talk from my personal experience of quarantine. So I'm white, Irish, French, you know, I was able to leave Paris and go to the countryside. So I was in a very privileged position. This is obviously a class issue and also a racial one. And so my experience of COVID has been, apart from a lack of internet access, it has been just like I've had loads of time for myself to read, to work, to you know, start doing these, start our platform, keep my job at the same time, work from my country house, you know, over there. And I think it's a perfect example of somebody who's white, who's in a privileged white position. And, you know, I didn't even have to think about in any way about conflict with my family, or conflict with my household. You know, I didn't have to think about any of those issues. Financially, I was fine. I'm still getting paid, even though I'm working half my hours, you know. It's definitely an important question.
Yeah, because at least in my experience, I've been home alone for the most part of the quarantine for like at least the first month. But I had some friends, so I wasn't, you know, going entirely crazy, but I was close to it. And even then, I knew at least my experiences were grounded in the fact that I was in a central London apartment, feeling bad about the fact that I can't go outside, as opposed to being in a worse like position. And my mom actually mentioned this to me, and she said that, you know, as much as it's a bummer that, you know, we may be going through our mental health struggles at our like socioeconomic level, there's still a privilege that we carry in general that like never goes away. That being said, I did insist that, like, you know, there is an importance of not taking away from the experiences of people who are, you know, just experiencing like mental health issues simply because they're privileged as well.
Yeah, it's just what we're trying to point out, I think, is more the over-representation of who is really, because of course, you know, like I'm thinking of someone who has abusive parents and who's stuck with their parents. Like, no matter what color you are, that's going to be incredibly difficult. Like, if you're trans and you haven't come out to your parents, and you know, something like that, you know, like and that's not necessarily, of course, race intersects, but it's not necessarily solely about that. And I you know, I think in this conversation and in other conversations, pointing out the oppression, the systemic and systematic oppression of people of color is not in any way minimizing.
Yeah, no, 100%. Yeah.
You know, so
I read an article by a friend of mine who wrote about living, like being South Asian voices within quarantine, and she's from India, and so she wrote about being home with extremely conservative parents or family members or extended family members and stuff, and how the readjustment period looks like. Because for international students, most of my friends like went back to whatever country their parents live in. I didn't, but most of my friends did. And so quite a few of them are having to, like, are going through a culture clash, essentially, where they are experiencing, like, having to, like, live under their parents' household, but they're so far removed from maybe the more conservative parts of their culture that they're having to deal with that on top of everything else.
Yeah, and also, like, you know, talking about things broadly, kind of opening up the conversation on like a global sphere. You know, obviously we've been talking about like the UK and the US in regards to like the coronavirus, but we even, you know, have a privilege of being, you know, within the UK or within like a developed country where we have, you know, a healthcare system that can support such. And, you know, when we look at, you know, other like developing countries, and we look at like this threat of coronavirus, we see that, you know, there's a lot more to there's a lot more like socioeconomic problems to like exacerbate. There's a lot more like disparity between us and, you know, people in these developing countries. And so we also need to recognize the privilege of, you know, living in a place where we do have, like, well, in the UK anyway, like universal like access to a healthcare system, or like all have access to a healthcare system for free, as opposed to, well, obviously that doesn't apply to America. But yeah, I just wonder if anybody has any kind of comments about, like, from a global perspective, about the different kind of dealings or the different situations of coronavirus. And feel free.
I'm nervous because I don't have that's just what it is. Yeah, I don't have health care, and so I'm kind of fucked there, but
Yeah.
There are people in the comments, by the way.
Oh, is there? Thanks, Basil.
Oh, yeah. So Boston said, more people seem to be publicly expressing distrust in the government since lockdown. Are people waking up, or is this just a knee-jerk reaction response to authority, for example, being told to stay home? That's an interesting question.
We'll see. Okay.
But the thing is, okay, I've been bringing this up a lot. Just some background on what I said. Like I do a master's in human rights right now, and it's been very interesting listening to people talk about their human rights during this pandemic, because I've kind of realized that a lot of people are misinformed on like what their rights are, and the simplest way to explain the state of emergency is that within a state of emergency, your human rights are limited, but they're limited for your safety. So there needs to be a proportional response to the limitations. They're not completely removed. They're not, they're simply suspended for like a determined period of time, and you have to be kept informed as to why. But your governments can do this because the UN, like all these people got together, they established the UN, and they all agreed on a couple of conventions and basically a rule book of how to go about certain emergency situations, I guess, that states go through. So in the same way that your building has an evacuation plan, your state has an emergency protocol for everything. And so these states of emergency that were put in need to be respected because they are for our safety. And so I feel like people don't fully understand that because, one, human rights aren't like generally explained to the public well enough by their governments. It's not the responsibility of the individual to go and look up what their human rights are and the protocols in which their government needs to follow in the event of any emergency. That's not their responsibility. That is the responsibility of their assigned politicians to inform them, to keep them posted, to explain to them very, very clearly what's happening with their rights. And that's something that I feel like most governments, if not all, have completely forgotten to do. On top of the fact that they're like, oh, it's a state of emergency, they're not explaining what that is. People don't know what that is. If that's not within your regular repertoire, or if you're not a poli-sci major, then you're not going to know what that is, and you're not going to know, and that uncertainty makes you want to challenge it. And that's why we have people who are going out and protesting, and that's why we're all like, oh, they're so dumb. But it's not actually their fault. It's the fault of their government for not explaining to them why they are doing these things.
Yeah, I do agree. And like, going back to this question, like, are people just, is this a knee-jerk reaction to staying at home? I feel like in such a big crisis like this, in such a big event as this, we haven't really experienced such an event in our lifetime. I don't think we'll probably experience something like this again in our lifetime. It's a crucial time for, as Chelsea says, as for the governments to explain and for the governments to act and order. And so I think, before, as we're living our day-to-day lives, if we're keeping up with, I lost my train of thought. Wow, my brain is just like here, there, everywhere today. But yeah, in our day-to-day lives, obviously, like normally, yeah, there is that element of, you know, we're probably not, we don't probably don't have as much time maybe to even think about such things. But at the same time, you know, it just highlight like this time, this crucial time where a decision needs to be made on such crucial matters. You know, it highlights like the inadequacy of the governments when they are, you know, when they're not acting, when they're not explaining, when they're not doing things. And so I don't think necessarily like people are just, you know, bored at home and they're, you know, just trying to look for some antagonism for their governments. I do think that, you know, people are waking up, and when you have, you know, Trump saying to inject yourself with like bleach in such a crucial time, you know, people are realizing because they're frustrated, they're stuck at home, yes. And then, you know, you have a government who is just acting irresponsibly. The same with Boris Johnson. You know, we can talk about this, as Chelsea was talking about, this kind of like ambiguity with what they're saying. Like, who knows what they're saying? They're not really saying like A, they're not saying B, they're saying some like strange thing, like warped thing in the middle. You know, they're not being clear in this time. And so I think people should rightfully, you know, be critical of the government. And I do hope that this, like, I honestly hope that this time, of course we know that this time is, because it's so critical and it's such like a prodigious event, I do think that there's going to be such a shift, or there's a potential to be like such a shift of, you know, the way that our world is governed after this, because it's literally just kind of unpicking, you know, how irresponsible our governments are, and like unpicking, you know, capitalism, if you want to say, you know, Aesop mentioned it, but I would argue it's unpicking maybe like the inefficiency of capitalism. And so, you know, it has made us all look at the structure that we live in and question, you know, what can we do? What are our governments doing? What is going to happen? So yeah, I guess it's like a bit of both to answer your question.
I worry about that too. I worry about that too, though, because like, I don't know why, but Donald Trump, he just explicitly lies to people, right? And lies to, I think a key part of this is like education for people to equip themselves with knowing what's false and knowing what's not. I don't know, they need some sort of tools that they're given. And I just feel like the genius part of Trump being able to continue his reign and continue this kind of form of control is by undercutting education and just feeding lies to people, because it just seems to be working in the US. I thought that there was going to be a shift when the economy tanked, because that was the whole thing that Trump was getting a lot of praise for from the conservative poor community. But now there's so much misinformation that I see, even spoken in my community, that I don't know how this is going to shake out, because I feel that our leaders my leader has such control of his narrative, and people have such little access to things to get themselves out of just believing whatever the fuck he has to say.
I just wanted to jump in there quickly as well. So like, I think it's important to not sort of, you know, I feel like the Tories have kind of, in the UK, for example, have kind of presented this concept of, you know, oh, we're just sort of bumbling our way through this, you know, we'll all kind of think they're a bit incompetent. And, you know, and on the question of, are we just sort of knee-jerk reacting to this? I don't think so. I think, you know, it's in the spotlight suddenly, you know, as you're saying, like the inadequacies of how the state is structured has been completely thrown into, you know, it's the slightest basic hit to it. The way I see it a bit is like, you know, how cheetahs are like an evolutionary dead end. So their bones are so light that a gazelle can just like kick them and it will kill them instantly. So capitalism and the way that the state is structured, similarly, to use a really strange metaphor there, is, you know, quite similar. It's designed to be fast. It's designed to make as much money as possible, as quickly as possible, you know. And then the second there's the slightest thing, you know, and this is back to sort of when I was talking about South Africa, who's, you know, at the same stage when the UK had about 19,000 cases, they've managed to only have 200, right? Which you could say is a success. but they're having massive criticisms because obviously the economy there is much more sort of, you know, it's not as stable as the UK, you know, so it's not as easy to just sort of pay out people to not go to work and stuff. So that's where the real damage is going to come from as well. And then also here in the UK, you got to think about these loans for businesses are really badly designed. So they're basically either they're going to charge the businesses really high interest rates at the end of it if they survive, or if they collapse, the government has said that they'll guarantee that they can sell off all the assets of the business, and then they'll top up whatever's left that like wasn't made back on the loan that they gave. So that basically encourages them to really undervalue the assets, sell off all these businesses for cheap, and, you know, then get it funded by the taxpayer, basically. And the important thing to remember here is like, this isn't sort of things going wrong in a way. Actually, this is sort of exactly what's meant to happen with capitalism. Like, we have basically every 10 years a guaranteed recession, which is basically like a massive bargain sale, right, for all the rich people who can basically, they've got assets that they can hide from a tanking economy, and then they can go clean up the mess afterwards. And, you know, what you were saying, Fiona, and with those black businesses in your area, like, that's kind of potentially where the biggest struggle is going to hit, you know, because where's also the support going to go to afterwards. You know, it's more likely, it's already going to, in America, I saw the first round of business funding ran out like immediately, and it was all like the biggest companies that got it, you know, none of the people who were actually supposed to get it. So anyway, that's just a bit of rant over.
Yeah, actually going.
I have a question.
Sorry.
Yeah, I just wanted to ask Fiona a question about, so regarding some states in America, particularly the ones that have done sort of the more outrageous things like armed public protests in Michigan State House, for example. Do you think that is something that really reflects, say, the success, if you will, of misinformation, or do you think it's something a little bit more of an outlier? Because my understanding is these people are doing things that, like I said, are really kind of off the cuff, but it speaks more to me of revolt against, say, ideas of lockdown, restrictions on freedom, rather than, say, notions about healthcare. This is what Trump says. This is what Dr. Fauci says. What's your thoughts about that? And do you think there is some misinformation being used here? Thanks.
Unfortunately, I think that those people are less fringe than they may appear. I also think it's a little bit of, I don't know if this answers your question, but it's a little bit of a mix. I find that the misinformation that is given to people via things like Fox News and like InfoWars, Alex Jones, these like very widely popular listened to media outlets that can say whatever they want. There is an agenda with that, and it's almost the message of these are your rights and also everything's getting better. So it's misinformation and also like blinding people of the issue, allowing them to not worry. I think it's kind of both. I don't know if that answers your question, but if you were to watch like our local Fox station, it's really scary, kind of the blatant message that is being sent to people about how the numbers aren't as bad as they seem and how workers should get back to work. And if you notice, it's actually really interesting and scary. Fox News has its like evening hour at 5 p.m. our time. And you can track it when Fox News has their like national hour of news giving with old white and blonde women speaking. And like 30 minutes after that program airs every night at 5 p.m., Donald Trump has a slew of tweets that are basically like the Fox News script, but just turned out. So like for a while in the beginning of this 2 months ago, Donald Trump started tweeting like free Michigan, free Connecticut, free all these places because Fox News was saying, we don't want these stay-at-home orders, we need these places to be free. So I think it's a mix of people being in echo chambers of where they get their news and also who owns those news conglomerates that are feeding people certain messages. So I think that those people are not as fringe as they seem. The sales of guns in the US like skyrocketed when COVID-19 happened. Like I went to Walmart and I just asked because I was curious. I went to the gun section and they ran out of ammo for like AR-14s, AR-12s, 47s for weeks. They didn't have ammo. And it was a knee-jerk reaction, but it's also fueled by this like narrative that I think is working.
No, thank you. That is really, because like this is just my last sort of like observation. It's not a point per se, but like I agree with you in terms of when it comes to American media news coverage in the mainstream, it is very polarized. And one way of looking at it is, depending on your own point of view, if you're an optimist, you could look to Fox News, but if you're a pessimist, you could look to CNN, because essentially to me at least, there is a dichotomy in the way that they present the facts, and the facts come from things like how does Donald Trump present himself on the news today, or what are the numbers that are coming in. Either you choose to say this is really bad, or you choose to say it's not that bad. And I think these kinds of sentiments are echoed in this country as well, certainly to the effect of blurring the lines, what's right, what doesn't work. And it all kind of boils down to this whole thing about it's very unprecedented. This is new territory in terms of how nations need to govern themselves. So yeah, it is very complicated. But thanks for that. Very
no worries. It's also unfair in a different way, because you also have Donald Trump, who should be a president, should be someone who we could trust, calling CNN fake news, like telling certain journalists to get the fuck out. Like I'm a journalist, and when Donald Trump became president, the environment for me working became extremely hostile. I don't know what it would be like to be an African American journalist in my position, because I go to odd places that I would feel uncomfortable with. But you also have a president that's saying there is a right and wrong. It's not just a presentation of facts. This is wrong. Fox News is right. Trust it. So it's like, what are uneducated people supposed to do with that? Like, I have sympathy for these people that are loading their AR-12s and AK-47s, because it's like, they're scared because they don't know what else to do.
No.
I'm not trying to excuse them.
Of course. But yeah, it's very fair. It's very fair.
Yeah.
I have another question in the chat from Chebwa. Thanks for joining, by the way. And it's, what's your take on COVID-19 on spiritual gatherings? I don't know. I guess like in the space of like spiritual gatherings, as much as it's maybe it's embedded in a culture, or embedded in a community or a religion or something like that. I guess, I mean, I don't personally have so much of an opinion on it, but I guess, if we are to obey the orders, like, these cultural events can't really take place. I don't know if there's anything more to say apart from that.
I got one, because for example, sorry, it's just really quick. For example, Ramadan was, I don't know if it's still happening. I reckon that it's over by now, or maybe it's nearing its end. But yeah, I guess it's a real question, because I'm not Muslim, so I don't really know how people who practice Ramadan might have, oh, it's still happening. Okay, so yeah, I don't know how people might have catered to it, if they're meeting up with their families or not. No idea, but yeah, I think it's a relevant question, definitely.
I guess, like, in response to talking about Ramadan, it was actually on BBC News, like maybe last week or the week before. They were talking about, kind of different ways to celebrate Ramadan. And so I guess it's a question of taking, what we perceive as normalcy in our normal everyday life, and just molding it through, into, I don't know, web chats and things like that. So I guess, within this whole coronavirus, this whole quarantine, a lot of the time we are just moving things from our, real tangible world and putting them, like via our like computer screens. And I know like for Ramadan, people were kind of joining each other via like Zoom and things like that. And instead of going to mosque, the few people that did go to mosque would just, you know, broadcast it to everybody, and then it would, you know, everyone would join in. So I guess, yeah, it's just everything moving from tangible reality to virtual reality. But yeah, I don't know what more to add. Oh, my laptop.
Alex just, they are not able to meet up or go to mosques, which they usually do every evening this time for prayers. So yeah. You were going to say something, Chels.
Yeah, I was just gonna say, I go to church, like my family goes to church, and like like most churches are online now, so like you can like watch them live on YouTube or stuff like this.
Oh, actually, that's a good point. I listen to church online, which I never do, but my mom forced me to do it. So yeah, we did it online. It's a bit weird. My grandma was telling me that she was wondering how to get communion during. She was like expecting to get it by the post or something. I don't know. So there's another question. Vaccines and 5G. Ooh, this is a question for you, Tristan. Vaccines and 5G are examples of scientific advances that have been publicly lynched. Is distrust in science becoming a thing? What will be the next paradigm / convention we become skeptical of, if any? Anybody want to throw themselves into that question?
I actually do have loads of thoughts on that, obviously. I think it's quite an interesting thing. So I watch Donald Trump's daily addresses basically every day because it actually cheers me up quite a lot. I feel like we're doing a lot better here in the UK after I watch him. I'm sorry, guys, but it does. But one thing I have noticed very specifically, and it's been happening here in the UK in a different way, but in the US, it's definitely, there's like a sort of rupture between sort of what the government is saying, being led by, you know, sort of specifically Donald Trump's government, and then sort of what the science is saying, you know, and they have to like very carefully tiptoe around, you know, not upsetting him, but whilst being completely factually accurate. And equally here in the UK, you know, with the Sage, there's been quite a lot of politicization behind it, you know. It's been secretized, and the whole problem is that everything's been secret. So, like, basically, no one's, you know, people distrusting the government, like we were talking about earlier, but it's because they're not being clear. Like, you know, if you're just absolutely clear why you're doing things, then, you know, people are obviously going to be able to, you know, they might have questions or something. And, you know, as we've seen, actually, politicians have more often than not nowadays been like, look, we just don't know, do we? But I mean, in terms of sort of 5G, I mean, that's just really the people setting fire to the masts and stuff here and saying it was causing coronavirus. This is what happens when you have these sort of social bubbles, like you were saying with InfoWars and stuff, where, and I think actually this is another point, it's sort of like a layer that we're missing in society, just sort of like that local political environment, basically. Because it's just sort of like the state, which is like way up there, you know, they make the decisions. And like you were saying with Chelsea in terms of the human rights, when this gets suspended, you know, there's no sort of, you know, they're just talking about sort of blanket bans across the country, and they're not able to sort of fine tune it on like a specific area because there isn't just really that kind of infrastructure set up. You know, there's sort of councils here in the UK and stuff, but then even on a local community level, you know, and that goes back to the whole sort of first past the post system here and how that sort of excludes people being properly represented, basically, especially in terms of BAME communities and stuff. So yeah, I mean, it's all about breaking the social bubble, basically, and getting people educated. As Mandela would say, education's the best thing.
Yeah. Oh, can we have background on specifically why this had to do with Tristan? No, just because I believe you work in 5G, right? Or something to do with 5G.
Yeah, I work in the internet. I'm one of the internet fairies. I make the whole thing tick in the background. I don't actually specifically work with 5G, but I do.
Oh, I thought you did. Okay.
It's not like it's got literally. There's, just to be clear, there's absolutely no bloody way that it causes coronavirus in any way.
Oh yeah, yeah. I didn't believe that. No, I just for Tristan because he's the one who explained to me how 5G worked and how 4G worked, and he illuminated my knowledge on that particular one.
Some crazy stuff, but I'll bore you about it another time.
Yeah, does anybody have anything else to add? I had something written, but now I can't remember why I wrote it.
Okay, I have something to add. I read an article this morning, which it was on, I think it was on like Center of Pan-African Thought, and the article was basically about how the Madagascan leader at the moment has come up with a like treatment for coronavirus called like COV, and basically he's gone to sell it to like different African countries, and obviously saying that it's cured many cases in his countries, and a lot of African countries have received that response like well, and have bought, or or the leader has given it to them like without cost. And basically the whole article was talking about the distrust of like traditional medicines. I mean, obviously we don't know if like the medicine actually works, but the whole article was basically talking about, because obviously the COV was like a mixture of, I think it was like chloroquine, which is normally used to treat malaria, something else, and then kind of like loads of herbs. And it was talking about how obviously Africa, a lot of the countries rely on kind of like herbal medicines and things. And I think, I can't remember the statistic, but maybe it was something really high, like 80% of like people in Madagascar, rely on like herbal or like trust in like herbal medicines and things like that. And so yeah, it kind of opened up the debate of, do we just look at these kind of medicines from these African countries and see them as not worthy because of where they come from, because they come from the dark land. And obviously the World Health Organization released a statement like about this very issue, about this COV, and basically said, obviously we can't trust this, we need to look further, which is rightfully so. But I don't know, I just wondered if anybody had any comments about such, because I thought that was like a really interesting article.
Anyone?
I mean, like, certainly, again, for something like this, which is so novel, I think many countries are quick to realize, with the kind of panoply of drugs that they have, like they can pick from, very little to none showed any kind of effectiveness. And you kind of, this is why, I think there's a lot of pressure on, not just ignoring, put aside politicians, but there's a lot of pressure on how experts, in particular, medical experts and researchers, present themselves on the stage. Because on the one hand, they kind of want to make it clear as people who could hold the key to solving this problem, to basically give hope, but at the same time, make it very clear that when it comes to scientific research and making discoveries and finding things that can be translatable from the laboratory bench basically to the patient's bedside, it takes a long time, and it takes a long time to get right. And the weird thing is that whilst you will invariably come across studies or reports or articles or even anecdotes saying things like, yes, this thing could have a positive effect on a certain scale, shall we say, whether it's small or positive or not, people will always latch onto that and think, oh my God, this is really good. And again, the problem is you kind of really have to be very disciplined and take a very tempered approach when it comes to making these kinds of announcements. I think this is, again, I think like you have, yeah, and again, it is frustrating. I think that's just the word I'm looking for. It is frustrating because at the same time you think, how long can this go on for? But at the same time, you really don't want to be someone who makes the mistake of getting it out too early without enough validation being done. And it's a point that's very hard to get across, because one thing I've noticed certainly in say COVID, how COVID is discussed in the media, is there is a huge disparity in the lived experiences of, say, people who work on the front lines in the healthcare setting versus those who are asked to stay at home and are listening to the news that they see on television and they hear on the radio. And this disparity, this gap, you know, it really makes it difficult to empathize completely with one side over another. And again, when it comes in with things like, you know, possibilities of cures or treatments, vaccines, etc., you know, people really want to look for the positive side of, you know, they're looking for, you know, glimmers of hope, etc. But again, depending on how you temper yourself and how you approach this problem, either you lurch to it, like you just run towards it without really kind of appreciating all the complexities that come with it, or which is, you know, obviously the kind of like the most positive, optimistic thing to do, or you kind of approach it kind of rather calmly, coolly, but at the same time maybe perhaps a bit pessimistically, passively even, because you're just not really, you know, you're just basically exercising caution. And again, in a situation, in the world we live in now, like where, you know, information, it's the information age, everything is transmitted at 1,000 miles per hour. There's so much choice in things you want to listen to, what's available to you. You know, it's kind of, it's very difficult to strike a good balance, I suppose, in getting a message across. So again, you just kind of need to take a really disciplined, really nuanced approach. And that is hard, honestly, that is really hard. Especially if you're someone who everyone's waiting for an answer from, you know, that is really difficult.
Our computer's making loads of noise. Oh no, it stopped.
Me.
Yeah, just suddenly, maybe it was mine, I don't know. Yeah, off onto something else. There was something that I wrote earlier. I can't remember why it was in relation to something that was being said, but now I can't remember what it was that was being said, but I'm gonna say it anyway, because I think, all right, let me read this and see if there's any point in me actually saying it. Yeah, I kind of just wanted to mention something that was, I can only speak from a French perspective for this particular one, but I think this is very real for, I don't know about the United States, but definitely in the UK. So in France, I think medical staff has been en grève. They've been protesting since, I don't even know how many years it's been, but you know, they're very much with the Yellow Vests movement. Even before that, they were with Nuit Debout, which was I mean, we've seen medical staff as very much part of the protests in France in recent years. But the thing is, there's such a lack of funding here and in many other places too, that they can't even actually protest. They just have, like, on the back of their blouse, they've written like, I'm protesting at the moment, but they're at work. Whereas normally if you're protesting, you don't show up to work, everything's closed. Obviously, because they're nurses and doctors, they can't do that. So they're showing up to work, but they're in protest, like as a status, they're protesting. And yeah, I just kind of wanted to know what you guys think about that, you know, like the fact that, I mean, Lisa mentioned it throughout the presentation, but you know, like the fact that we're clapping for them at 8 p.m. every night, but at the same time, especially not us wise, like, but more politicians wise, you know, what do you think of this rhetoric around how they're heroes and, you know, we need to support the NHS and like, thank God for nurses, but then, you know, copiously defunding and privatizing these pillar institutions of the UK and France, for example.
Yeah, but I just want to add to that. In the UK, like people like Boris Johnson are people that have voted against the increased funding of NHS workers, and I think as well, like Rishi and a lot of, you know, the like conservative frontmen have voted against, as I said, the increased funding. And so again, it's just such a hypocrisy, because you're actually acting on your day-to-day, you're acting against this institution, but you know, now that we need them. And also, just I think a few weeks before lockdown, Prissy Patel, the Home
I
Secretary.
think she's Foreign Affairs. Minister of Foreign Affairs.
Wow, that's
She's the
so
Home
bad.
Secretary.
Oh, she's Home Secretary.
Basically, she was calling like all of these low-income workers like unskilled, and then we have coronavirus, which just starkly illuminates that these are the people that we rely on. Like, right now it doesn't matter about the people going up in and working in kind of like corporate offices and stuff. The people that are at the backbone of this right now, of the crisis, are the people that were deemed unskilled and verbally attacked by her and through other Tory ministers. And so yeah, it just shows, like, as I said, like just this deep hypocrisy. I use the words cognitive dissonance. Like, now we all turn to them, but on our day-to-day, like, we don't even stop and think about the institution, who makes up the institutions, like how it's underfunded, like how we treat them, like what the public perception is of them. And I hope that through this, people can look at our leaders and they can look at what they have done previously to negatively impact these people and these institutions. And I hope they can realize that these people, they're not just inadequate now, they've always been inadequate. It's just now we have.
Oh no! Oh no! What happened?
I think her computer died. She said that she needed to find her charger.
Yeah.
Oh no! It must have. Oh well, she'll come back. She has the link. Yeah, actually, talking about what she's talking about right there. Well, presumably the British, the people who live in England might have looked at what Boris Johnson said, but that. So what exactly? I can't remember what the new slogan is. The only part I remembered is "Stay alert," and I just think that it's so interesting because about what Lisa is talking about there, it just completely de-responsibilizes the government from any accountability. It's really just like, if you don't stay alert, it will have been your fault. Something happens. Oh, bye, Chelsea.
Bye everybody.
Bye.
Bye.
I'm just gonna message Lisa, see if she's coming back. Does anyone else have anything to share, anything to add?
I guess on the NHS point, isn't there a positive, side of that, where as people now recognizing how important the NHS are, hopefully we don't lose that, but as a result of that, will it not make people more aware of, say, certain positions the government have which might negatively impact the NHS? I guess the positive point I see here is we're starting or continuing to see how valuable the NHS is, and were it not for the NHS in this country, what sort of situation would we be in? So I'm hoping that stays with us after Corona, and I guess makes our NHS untouchable in some sense, and any sort of policies that the government try and put through, I hope people keep that in their mind. But I guess, are your thoughts that it's just, as of now, we're supporting them because we're like, oh, we're going through a tough time and we need a hero, and then when we're through it, we'll be like, oh, fuck you.
Yeah. But I was hoping that, especially since, okay, I don't mean to be a conspiracy theorist, but since Boris Johnson supposedly contracted the coronavirus, one would hope that now that he was a victim of it and that he really needed, well, to be fair, he didn't even need the NHS because he can afford private health insurance. But yeah, one would hope that with that, having lived that experience himself, having maybe seen some of the damages that it causes, that he policy-wise would change his report to the NHS. But yeah.
Do you think that would realistically happen? Like,
I don't know.
I don't know what to expect, because I guess you can't really trust a politician say. So I don't know, like, because didn't he name his child after
Yeah, I think I watched his interview like just shortly, and like, I watched him quite closely when he just came out, and he looked like shook, like, and I think it definitely kind of changed his view. His initial speech, he like gave a specific shout out to the fact that he had 2 immigrant nurses looking after him. And actually, on another point, it's quite interesting with the whole Priti Patel thing. You know, we've been dealing with this whole Brexit thing for like 4 years. You know, banging on about immigrants, and now suddenly coronavirus hits a thing. We're busy flying as many as we can in to pick all the fruit that we don't have people to pick for in the UK.
Yeah.
And then just on another thing that I don't know if you guys really touched on is there's the whole the UK has taken a massive lead in sort of how we deliver the oh god, what's it called now? The cure to the virus, basically.
Chloroquine.
The vaccine. That's the word I was looking
Vaccine.
for. So, like, when we get a vaccine, right, we're gonna have to make loads of it. That's already a thing in itself. But then, like, you know, okay, so sure, the UK might, or the US, let's say one of the two of them invent the vaccine. You know, they can make it for themselves, or the other one can buy it. But then, how does all of Africa get it, right? And so the UK has taken a massive leading role in sort of how we deliver the vaccine to Africa, which it should be noted, they have a massive thing going on at the moment to invest in Africa as sort of, I think it's one of the key targets that they're kind of going for post-Brexit.
In what sense? Like invest in Africa? What do you mean?
So, as in, you know, they're basically quite clearly still heading for quite an intense no-deal Brexit in a way. Like, you know, hopefully this kind of situation will mitigate that to some degree, but, you know, they look like they're trying their damnedest to still, you know, make it catastrophic. But so they need other markets that they're going to form sort of future relationships with. And one of the key markets that they're looking for is Africa, because obviously Africa's has like most of the highest growth rate economies in the world, basically. So they're growing really quickly. The UK needs somewhere to invest and kind of build an international partnership with, because that's part of capitalism.
And what's better than the next colony for that?
Exactly. Yeah, so they've already got history links with it, right? Really friendly history. We all remember that.
Oh, what a coincidence.
Let's just go back there again, is basically what the Brexit bunch is saying. Not what anyone wants to hear, but that seems to be what's happening.
Yeah, they've got competition with the Chinese, don't they?
Yeah. Exactly. Well, but the UK is, right, I think they're trying to position themselves as a point to kind of negotiate between China and the US in Africa. But anyway, that's just hypothetical.
Yeah, that's interesting. I wasn't really aware of that.
Well, I mean, when you consider how resource rich, you know, all of Africa is, it's got massive potential. It's also got like the youngest population in the world. You know, it's basically, you know, they reckon that it could be kind of like Africa century coming up, essentially. So, you know, as Asia will eventually wane, as Europe's now currently waning, then Africa will take over, basically.
Yeah.
But will
so people
Africa,
are trying to yeah.
But will it be Africa taking over? Or will it be, you know, the Chinese and the British who are investing, which means, you know, exploiting? Then surely it's just them that are going to take over. Like, I can't see, or, you know, with what you've just said, obviously it's not going to be like a fair exchange. We all know that it's just going to be, as Esau said, you know, colonialism times two.
Well, I mean, you know, that is obviously my worry, and you've got the whole problem with China as well, you know. Yeah. But then China's been sort of weirdly overall benign, I guess. Like, you know, there's been sort of problems of not training locals up and stuff, you know, but they haven't like exactly gone scary just yet, shall we say.
Do you think they're benign though?
I don't, no. But China's specific position that they're trying to go into the world is to position themselves as sort of the friendly face. So the US has just sort of abdicated the throne effectively. But a lot of people don't trust China due to the US basically accusing them of all kinds of stuff, and, you know, them having done quite a lot of stuff themselves as well. Like, so basically there's a lot of, particularly at the moment in COVID, they've been sending all these sort of PPE stuff to people around the world. They've been helping out loads of countries in terms of financial support, you know, and there's all kinds of deals being struck right now in terms of that. So I'm not hopeful for that, but I do think that the AU, the African Union, they've got a really good chance now as sort of a single negotiating bloc. So that might actually give them a sort of head chance, perhaps, against a player like the
I was
UK.
going to say, because we're talking about the Chinese and the British, I was just going to say also we should note how important the French are in all of this, because I think as a French person, we tend to totally, one, negate it, and two, just kind of brush it under the carpet, like, oh, you know, they still have the CFA, which is the franc, it's an African franc, which is the money that I mean, it's just mad. But I forgot what I wanted to say. But yeah, Fiona, I can see you wanting to say something. Go ahead.
No, I just commented that last month the state of Missouri tried to sue.
I saw that.
For the coronavirus, and that's just like the.
Why? Because were they suing them for having created it in a lab?
Yeah.
Oh.
And that was like our state judge, like the state of Missouri literally thought that and did that.
Wow. Why would you spend all that money on that lawsuit, you know?
And literally all China said is like, oh, this has no grounds. Like, of course.
I know.
Their lawyers.
What grounds were they expecting it to be on? Like,
was it really because they said it was grown in a lab, or it was rather that China, inverted commas, failed to control it properly?
I think it was the second one, actually. It was because they basically weren't they saying that basically China held back so that they could stockpile the PPE so that they could then give it out to everyone afterwards.
Yes.
No, it's not.
There's
it's not it wasn't a criticism. I just want to clarify because one is clearly disinformation, and the other is slightly more, shall we say, realistic. But yeah, okay, thanks.
I think one of them was both two states sued, Mississippi and Missouri, and I think their reasoning was, it was stockpiling. It was the first reason. It wasn't because they created in a lab. That was me, just being wishful thinking.
It's cool.
But they did call it people call it the China virus to my face, in public, and that's. I don't know. I think there's an underlying thought about that.
Yeah, no question. But yeah, I totally get that.
That's really interesting, calling it the China virus. But then again, when you exactly as you were saying earlier, when you have a president and when you have the federal news outlets that are just spouting all this complete disinformation. I saw this one woman, she's a Fox News host, I don't know what her name is, she's kind of this middle-aged woman, I don't know, she looks Middle Eastern, but she's really radical right, and she always spews really, really racist things, and she was just, I don't know, I just saw this 2-minute video footage thing where she was just kind of, I don't know, she was just saying really outrageously racist, anti-Asian things on TV, and it's just, as you said, I have to some extent empathy for the people who are on the receiving end of that if they don't have the tools to dismantle that themselves, It's kind of, it's hard.
And it creates frustration because I think that the people, I live in a liberal bubble of a Republican state. And I think sometimes the thought is well, get on the internet, inform yourself. You don't need to be taught how to work the internet. But 60% of rural people in my town don't have broadband. So they don't have internet. So it really is I don't know. It's a very deep, deep problem that they can't, it takes little local newspapers like the Columbia Daily Tribune to try to help out, but we're getting defunded and just furloughed and phased out a little bit.
Yeah.
Any other comments, guys?
There do seem to be some brighter sort of new forms of media I've noticed popping up all over the show, like Novara Media is maybe a cliche example over here, but it does give me. I've seen on YouTube as well. There's a huge sort of variety. Maybe you guys want to do a seminar on that at some point. Get Fiona in as a guest speaker, and like just on sort of how maybe whiteness and stuff has adapted in the 21st century to like digital media from where we were used to maybe with like newspapers and stuff like that, and all the classic sort of advertisements that we've been through all of that basically for the past 10-20 years, but like now things are kind of quite subtly different. One thing I would note, me and my mom have been laughing about this, we count all of the families in adverts that are mixed race families. Like it's like the